In this first bit, I'm going to talk to you about what is insomnia. So when we're looking at a textbook, what they teach us is that insomnia can be slightly different depending on what you're suffering with at night. So you can either have a problem getting to sleep, or you can have a problem maintaining your sleep. So that means you can get to sleep, but then you get to sleep and then you can't stay asleep. Or you don't have a problem with either, or you have a problem with both, and the quality of your sleep just feels really poor. So when you wake up in the morning, or indeed when you just are lying there awake, it just doesn't feel like you've had good quality sleep, even when you were sleeping. So what that means is you get a lot of people out there who don't think they've got insomnia because, for example, they only have an onset problem, so they can only not get to sleep, but then once they're asleep, they're fine. Or even if that takes hours. Or you might have someone who gets to sleep absolutely fine, but then can't maintain that sleep. So they're completely unable to just consistently have that night's sleep. So they'll wake up in the middle of the night and then they'll be up for hours and hours, or they'll keep drifting off and then keep getting up. So it can be very different. It can be long, big spouts of time, or it can be short bits of time where you keep waking up and going back to sleep. So it can present fairly differently in terms of what's happening night to night. And let's not forget that insomnia can be quite cyclical and seasonal even. So you might not have the same experience every single night. It can actually be wildly different. In fact, sometimes you can even have what you might call a good week. There are many different reasons why we can get insomnia. One of the most common reasons is stress and anxiety, and things that we that happen to us that we can't predict. But then there are lots of other things that can cause insomnia, like chronic pain, illness, different medications, lots and lots of different things. The interesting thing is that whilst all these problems, all these illnesses, all these things that can happen in our life that might trigger insomnia, we know that actually it's fairly normal to have sleep problems when you're going through a stressful time, for example, or something has changed about your life or routine. So that's kind of normal. But in people that have sort of a chronic sleep problem on top of those things, that's where it becomes a bit of an interesting area, because actually we can't really blame that original problem, especially, for example, for a real chronic insomnia that's had it for 20 years. They think it might be triggered by something that happened 20 years ago. We cannot any longer blame that original trigger 20 years later, when maybe they're not going through that original trigger anymore. Maybe they don't have that original stress, and yet they still have a sleep problem. So anything can trigger insomnia, but the perpetuating factors, so the things that keep it going, don't tend to be that original problem. And yet as humans, what we want to do is we want to focus on trying to sort that original problem, and until, sometimes we do sort that original problem out, and yet the sleep problem remains. So if you are having the sleep problem for 3 months or longer, and indeed patients that I see have had it for 30, 40, 50 years even, that's when you would start thinking, okay, this has become a chronic problem. So this is no longer just an original issue with stress, medication, chronic pain, frequently going to the loo at night, whatever you've been diagnosed with or whatever's happened, this is now actually on top of that a sleep problem as well. And part of our not really understanding it properly and not treating it properly is that we don't see those as separate conditions. So that's what insomnia is, and it presents very differently in everybody. Things that it makes us feel, we feel incredibly lonely when we're up in the middle of the night and there is nobody else up. It feels like you're the only one awake in the middle of the night. It can make you feel very out of control in your own life, almost like you're walking through mud or treacle, or just like in a fog, or just zombie-like in your own life. You don't feel like the same person anymore, even though it's quite invisible. People can't see what's happening to you, but you know that it's there. It's a constant pressure always there. And in that way, it can be incredibly insidious. One thing that insomnia is not is sleep deprivation. Now, the reason we know that, and we know that actually sleep deprivation, it can come along a little bit with insomnia, but it can't be chronic sleep deprivation, is because you'd either be dead by now or incredibly sick. And yet the reality is most insomniacs are out there, they're living their lives, they're not happy by any means with what's going on. It can make them feel very uncomfortable and very difficult to live their lives, but they are still indeed doing that. And in a way, that's the issue. Your brain sort of doesn't understand that there is indeed a problem that you would like to fix. If you have chronic sleep deprivation, what you would find is you would be incredibly sleepy all the way through the day. Now, this isn't fatigue like insomniacs struggle with. This is literally the ability to fall asleep in any given situation quite frequently. And indeed, before chronic sleep deprivation makes you sick, it will make you very sleepy. So it will try to make you sleep. So unless you're actively restricting yourself from sleep, you would be able to fix your problem fairly quickly. So although sleep deprivation can be a lot worse for you, it can make you sick very quickly, it's actually very quick and easy to fix. And that's why we know that an insomnia patient is not necessarily the same as a sleep deprivation patient. And that's really important to understand. Insomnia, unfortunately, as I said, it can be very insidious because of that, because your body seems to be able to go a long time without what you feel is the right timing and quality and duration of sleep. But in reality, your brain is just working in a different way, and we've got to try and get it working in the right way again. So what this means is treating the original cause doesn't necessarily treat a long-standing sleep problem. If you're under 3 months, then yeah, absolutely, you might be able to get rid of the sleep problem when you've treated the original cause. But unfortunately, once sleep has become a bit more habitual and chronic, unfortunately, no amount of treating that original cause will end the sleep problem. And some people don't know what the original cause is, and that's also okay. As humans, we do like to focus on, the blame side of it, in the hopes that that will fix it if we can figure it out. But in this case, with sleep in particular, it's not quite that simple. But that's a good thing because it means we have a very good treatment that can help.